Hi, I'm Charlie.
Hi, I'm Daisy.
Hello, I'm Gracie.
I'm Cadence.
And I'm Maya, and we're part of the treatment team.
Hi, my name is Jupiter.
My name is Nadia.
My name is Stephanie.
My name is Phoenix.
I'm Hannah.
I'm Ivy.
And my name is Tolu, and this is the prevention team, and this is our presentation on nutritional anemia.
Today, you've heard about many different prevalent diseases in Nigeria. You've heard about malaria, which is spread by mosquitoes, typhoid fever, transmissible through bacteria, and acute respiratory infections, which can be caught from a simple handshake. Now, let us introduce a different kind of disease, one that cannot be transmitted or caught. We will be talking about anemia.
This is what we're going to be going over today, which is the introduction of what anemia is and why we should care. And we're also focusing on the treatment, on what you can do, and prevention of how you can prevent it from happening. And lastly, the conclusion of how you can help it.
In Nigeria alone, anemia affects 68% of children. It leads to 35 to 75% of maternal deaths. And yet, it is an easily preventable and treatable disease, as we will see with our workshops.
All right, what is anemia? Anemia is a disease syndrome characterized by the lack of dysfunction or red blood cells caused by malnutrition.
So unfortunately, anemia often goes undetected, but with proper education on the types of symptoms that there are, it is very easily to be detected and treated. So these are just a list of the common symptoms. There's fatigue, shortness of breath, yellow skin and eyes, pale skin, chest pains, spleen enlargement, change stool color, low blood pressure. So as you can see, this is a very long-winded list. There's many more symptoms, but it affects the entire body. So again, it's very easy for people to detect it if they're educated on the symptoms. And then they can go to the doctor to receive treatment. So this leads us to the question, how is Nigeria being affected, and why are we doing this workshop for Nigeria specifically? So anemia is more common in low-income areas, which Bauchi State is a low-income area. This is due to, the reason that this causes more anemia is because people do not have enough money to buy nutritious foods to support their families that are full of vitamins and minerals such as iron, vitamin B12, and vitamin C that all help with the production of hemoglobin in the blood that can prevent anemia. And so anemia can also cause some of these things, such as fatigue, which makes it difficult for people to work, and it makes it hard for the providers to make that income, which again leads to more food insecurity and more anemia patients. Another thing is there are generational deaths, especially among mothers and children. And what this means is that when a pregnant mother has anemia or has anemia during childbirth, she is more susceptible to, first of all, death during childbirth, and also the child is more susceptible to anemia. And the cycle continues, and more people die from anemia. The next thing is poor adolescent development and growth, because if they do not have the proper nutrients and the blood is not properly does not have the proper nutrients, vitamins, and minerals that it needs, the child cannot fully grow, and again can lead to infant mortality and just deaths at a young age. And then the final thing is that anemia can decrease fertile abilities, which having children is very important to many Nigerian women as it's a part of their culture. So these are just some factors to consider.
Anemia comes in 4 different types of foods. The mild degree is 9 to 11 milligrams per deciliter. And something recommended for its treatment is the oral iron therapy or the diet modification. And for moderate, it's 7 to 9 milligrams per deciliter. And its treatment is for parenteral iron therapy. And for severe degree, its grade is 7 milligrams per deciliter. And its treatment is blood transfusion.
So there are also some more natural remedies for this, including moringa tea, avocados, and aloe vera juice. And these are all very common in Nigeria, very accessible and very affordable to many of the people in Nigeria. But I do want to make something very clear. These should be used as last resorts. these are in no way, shape, or form as effective or as reliant as clinical treatments, so these should only be used if either the patients do not have access to any transportation in order to get themselves to the hospitals, or do not have the financial ability to pay for hospital bills in order to maintain at least a somewhat stable system until they're able to get these things.
So now we're going to go over a brief overview of our workshop. So who is our target audience? Our target audience are pregnant women and mothers. Why are we doing this workshop? We are doing this workshop to raise awareness regarding anemia and the detrimental effects of anemia, and also to reinforce the idea that if you are having any symptoms of anemia, it is best to seek help from a medical professional. And lastly, what are the different activities that in our workshops that we're going to provide? We're going to have a pre-test, we're going to have a case study, we're going to have a fun interactive activity called Blood Buddies, which you will be hearing about later, and also we're going to be having a post-test. Okay, so for the first activity, the premise of our first activity is fairly simple. The facilitators will be dividing participants into different groups, and afterwards they will be reading out a scenario about a woman and her child is having symptoms of anemia. Afterwards, these participants will come together and come up with their own solution on how they will go ahead with this situation. After they share their solutions with one another, the facilitator will correct any incorrect solutions and give the best possible choice. And the entire point of this is to reinforce the idea that if you're having any severe symptoms of anemia, you should definitely go seek professional medical care.
Now, our second activity is called Blood Buddies, and as you can see, you have the bottles that we used in the example video in front of you. With this activity, we will be focusing more on the specific treatments for the different symptoms of anemia and the different levels of them. Participants will be randomly given cards with either different levels of blood, varying between highly anemic with low blood, moderately anemic with more blood, and mildly anemic with the most blood, but still less than normal, than healthy. Cards with an outline, they will also be given cards. They also may be given cards with an outline of a person with varying shades of color, with darkest representing mild anemia and lightest representing severe anemia, or a treatment that matches up with each level of symptoms. These treatments are, as you saw earlier, iron supplements for mild anemia, IV treatment for moderate anemia, and blood transfusions for severe anemia. With these cards, participants will walk around and find their matches in order to further connect the levels of anemia with the symptoms and treatment, while also connecting with their community.
And finally, we wanted to give them something in order to take home. So these are the take-home cards that we'd be providing to them. And not only do they have clear illustrations that help to remind them of the different types of anemia and the common treatments used from the hospitals, but it also allows them to help educate others in their community by also giving them similar resources that we gave them in the workshop, allowing for more information to be spread about this so the most people can learn.
Now, the good news is that anemia can be prevented. However, in the past, it's been proven that there are a lot of misconceptions surrounding the prevention of iron deficiency in the blood. So, with that being said, how exactly as we individuals in the USA help prevent anemia from happening in Nigeria?
To further illustrate, some of the people at risk include malnutrition communities, people on blood thinners, and pregnant women who are constantly dividing their blood among their fetus. All result in chronic blood loss or anemia, a detrimental and sometimes fatal ailment to other lives.
A couple of risk factors include having intestinal disorders and being a young child. The best overall prevention method to combat these factors is regulating your food intake and diet. Even so, immigrants, those in poverty, and those with depression are more at risk due to their inability to enhance the diet.
There are also severe associated complications of having anemia. One of them is a possible impairment of cognitive function in children. Another one is maternal and fetal mortality rate increases, premature birth rates increase, and the body has trouble regulating its temperature.
So what we're finding in front of these risk factors
are the 20-minute workshops for pregnant women, which will include 3 different activities. Firstly, participants will complete a free test, and then in the form of a game. This will be completed again at the end of the workshop, so we can analyze both the participants' growth as well as the effectiveness of the workshop. Secondly, the participants will be given a brief presentation all about anemia and the disease in general. This will prepare them for the final activity, a game, which will allow the participants to get up and out of their seats to actively engage in the material that they are learning.
Our What Does Not Belong pre and post test goal is to obtain understanding on current knowledge regarding beliefs on iron-dense foods that may or may not assist in preventing anemia. How, you ask? In hopes that our workshop will encourage participants to emulate proper diet and palate that we show here. We plan to administer handouts and have them vote on whether they believe a food is rich or not. Come back and determine your support.
Our second workshop entails a short presentation and corresponding handouts. Although the presentation is rather short, the presentation is packed with educational content. To help participants retain information, we have created an infographic for participants to take home to review and educate others in their community.
Our third and final event is a this or that activity. The facilitator will give a question and give 2 foods to the participants. The participants have to choose which food is higher in vitamin C or higher in iron or costs the least. After they've chosen their size, the facilitator will tell them the correct answer. By doing this, they can practice meal fortification and it actively engages the participants. As you can see in the top left, you're given 2 different options, and you can choose which one has more iron. And then after they've chosen their size, on the top right, you can see the answer slide, and spinach is the correct answer, and that has 0.77 micrograms per ounce over beef, which has 0.73 micrograms per ounce. And this is a video representation of how the game would work.
Right here is a take-home flyer that students can take home with them, showing them meals that they should continue to eat that are nutrient-dense, and a list of different foods that they can incorporate into their day-to-day life, such as eggs, spinach, and beans, or even nuts.
Treatment for anemia and the kind. For mild anemia, you can take iron supplements. For moderate anemia, you need an IV infusion. For severe, you will need a blood transfusion surgery in cases of internal bleeding or other specifics.
The best methods of prevention include breastfeeding, proper weaning diets, and eating plentiful amounts of iron-rich foods.
So out of our budget of $1,500, $150 of those dollars would be going towards refreshments, which would include things like water, soda, and our choice for food would be shawarma, which is a very common and popular food in Nigeria. And it's also a meat-based food, meaning that it would also help to deliver our point that you should be eating more meat-based foods. Then for advertisement, we have $50 going towards flyers, which would be about $100, which would help to garner interest and participation in our workshop. And for treatment,
$60 would go towards printing out the activity cards for our Blood Buddies activity, which was our second activity. And then finally, $100 would be going towards printing the take-home cards. That way people can grab as many as they want to also help give them to other people.
The prevention portion of the workshop will allocate $90 to the pre- and post-test handouts, $60 for all about anemia handouts with information about the disease, and $60 for prevention food handouts. The remaining $974 will be donated to the maternity ward at the Nagiri Hospital to continue to support our participants after they leave the workshop.
As we conclude our presentation, we'd just like to say thank you to Max, Marshall, Umar, and Dr. Aisha for this wonderful experience. But we'd especially like to thank our team leads, Julius and Cuban, because they've been so supportive and have taught us so much wonderful information that we will carry with us for the rest of our medical careers.
Thank you so much.
Dr. Aisha?
Okay. Ladies first, as always. Thank you very much, guys, for this wonderful, wonderful red presentation. I noticed, yes, it was red. And it was really nice, concise, and straight to the point. You know, I love how, you know, I like something straight to the point and so concise, you know, no hard work needed. Okay, the warning signs you discussed in the very first or second slide, that was wonderful. Okay, it's always good to warn people if there are any, if there are any dangers or anything worthy of concern. That was wonderful. Okay, and okay, I actually have a question. I like these graphics and they're so good and real. Did anyone draw them or? Wow, wow. I was like, this is not a picture. This is hand drawn. You know, it's wonderful. It shows talent here. Okay, the take-home card, amazing. The graphics, everything about it was wonderful, really. And for the complications of anemia, I think there's one serious complication that was missing. Of course, the others were highlighted. Death. Okay, and I was expecting to hear that, you know, because I think it's the worst thing that can happen, isn't it? Like, okay, you know, out of the complications, you know, you can say that, do you know if you don't eat this, you can actually die? You know, so it's a way of actually highlighting the seriousness of this disease, because in severe cases, not only can you fall sick, not only can children not grow, but they can die. I have seen, you know, the first picture or second, I think, where the lady was carrying her malnourished child. In the north, malnutrition is very common. I have seen children, more than 100 children in the hospital. I have treated them, I have lost many. And a lot of them die as a result of anemia. Some die as a result of temperature control because they have lost all their body fat. So they are unable to regulate their body temperature. So death is really something worthy of mentioning, especially since we said women and children are at risk. Okay, so all in all, it was a wonderful, wonderful, straight to the point, concise and precise presentation. You guys really showed hard work and talent. I liked the video presentation, the demonstration, you know, of the blood, was it blood buddies?
Yes.
Yes, it was amazing. Well done, guys, and congratulations for this successful completion of this program. Okay, thank you, guys.
Just for the record, I pay more attention This is death. Guys, let me tell you this. Not just because you guys are presenting, had it been you guys just sit down and just play this, I would get it. It's simple, straightforward. You have a perfect demonstration. Like, you don't need to speak. Somebody was saying that there is no voice for the video. What else do you want? Everything is clear. I can see everything here.
Yeah.
And thank you so much for reminding me that this is not a juice. I could have just make a sip. So, yeah. So, and one amazing thing, thank God I'm going home. You did nutritional food. Oh, God.
I know.
You mentioned shawarma. I was kind of like, I want to be a participant. So this is really amazing. It's entertaining because you made mention of all the foods that are available there. People that really know all these foods, and you're kind of like identifying every single aspect of what you want them to consider that it is part of this food. So it is really important. I think that's the message. So your presentation, I think the three of us judges cannot have like more than 5 words to say about your presentation. It's just a straightforward, very simple, and it's communicated like clearly. And those videos, I need them. I need to play them during the presentation because it makes a lot of sense. It's very, very practicable, and people can see and they can get the message. So just like I said, when she's saying that, oh, you forget something about death, I was kind of like, death is here. I saw it. So this is really, really a practicable example, and thank you so much for making it so easy to explain, because that's all we need. So you guys, you should go home proud. Like I always say to all of you, I'm really proud. You can see how I'm smiling, how I'm happy about it, because I know I didn't just fly from Nigeria to come here and waste my time, but it worth it. And I'm going back home with something. And what is that something? I didn't take money from them, but I take something that is going to save their life. So this is what is important. So you guys should all be proud of yourself. You make a wonderful week, a wonderful presentation. I can't say more to that, but congratulations.
I don't have much to say beyond that, except something that really, really I appreciate. And I know we mentioned health literacy earlier. I know this wasn't the intention of this exercise, but even by setting it up like this, where you can see that, like, we know that when people are anemic, it's not that they have less blood in their body, it's just not as oxygenated, it's not as effective. And explaining that and trying to frame it that way could be really, really confusing for people that don't even understand what a red blood cell is and how anemia works. So like the metaphor of like you are truly just missing blood and you need more blood, and understanding that in a really straightforward way, yeah, it might not be the exact scientific explanation, but it leads to an outcome that explaining it in a scientific way you probably wouldn't achieve. And so that is the kind of simplicity and creativity and consideration of the audience that we are A, looking for in these presentations, and B, incredibly impressed that people your age are able to get in, not only like as without ever going to college and working in the field, but in a week's time. So really, really amazing work. And I have to say, you should all be proud of yourselves.